This is Jane. She's a 42 years old patient. She often feels weak, dizzy, and often experiences heavy, rapid, and irregular breathing patterns throughout the day. So she decided to visit the doctor. Unfortunately, the doctor diagnosed her with arrhythmia, and Jane now needs an artificial pacemaker to treat her symptoms.
The cardiovascular system is made up of the heart, veins, arteries, and capillaries. Its main function is to make sure that your body gets the oxygen, nutrients, and other substances it needs, and to get rid of whatever it doesn't need, which is referred to as waste. About 2,000 gallons of blood flows in the heart every day through two circulation processes, the pulmonary circulation and the systemic circulation. The pulmonary circulation happens back and forth from the heart and the lungs, while the systemic circulation takes place in the heart and almost all other parts of the body. An arrhythmia refers to a problem related to the rate or rhythm of someone's heartbeat. It may be too fast, be too slow, or simply have an irregular rhythm. An arrhythmia can range from severe to mild depending on the patient, but it's almost always best to get it treated. The pacemaker was invented by John Hobbs. He spent many years of his life studying radiofrequency. Hobbs then started conducting a variety of different heart experiments. He ended up discovering and observing the electrical impulse that caused the heart to contract and relax repetitively. In 1950, Hobbs started designing and building the prototype of the pacemaker after his recent experiments. Thanks to Hobbs, an engineer called Rune Elmqvist was then able to develop the first pacemaker, which was implanted for the first time in Sweden on October 8, 1958. Unfortunately, the pacemaker failed multiple times at the beginning.
The pacemaker is a device placed in one's body in order to help their heart beat correctly. The pacemaker is composed of three parts: a pulse, generator, one or more leads, and an electrode on each lead. The wires/leads are implanted in the veins and send pulses to the heart. Electrodes are able to sense your natural heartbeat, so when your heart is beating slower than it usually does, the electrodes send electrical pulses to your heart in order for it to beat normally. The life expectancy of a pacemaker can range from 5 to 15 years. There are three types of pacemakers: single chamber, dual chamber, and biventricular. The single chamber pacemaker sends electrical impulses to the right ventricle. The dual chamber pacemaker sends electrical pulses to the right atrium and ventricle. And the biventricular pacemaker, also called the resynchronization pacemaker, stimulates both chambers of the heart when it's too slow to keep it at a normal rhythm.
The electrical pulse starts in the SA node, causing the contraction of the atria to pump blood into the ventricles. The electrical pulse then travels down to the AV node. This node is in between the atria and the ventricles, and it slows for a short period of time. This allows for the atria to pump a fraction of a second before the ventricles, so they are able to pump blood into the ventricles before they pump blood out. Then the pulse travels down to the bundle of His, and it then separates into two branches, left and right. As the electrical pulse travels down the branches, the ventricles contract, sending blood to the lungs to be oxygenated or to be distributed to the body. With the pacemaker, the pathway of the electrical signal is the same, but the SA node is not able to generate the pulse on its own, so the pacemaker does it for the node, then the original process continues.
What are the possible causes or indications of arrhythmia that people have to look out for? The main causes of arrhythmia may result from a heart attack or could be genetically inherited from parents. Also, such defect can be a side effect of beta blockers, which are medicines to lower blood pressure and slow heart rate.